Now, for the next up, we are trying to establish a link between another disease condition and heart failure. All right. So this is metabolic acidosis. If there's metabolic acidosis, of course, you are trying to say acid is too much, in the body, and these issues is from the digestive system, gastrointestinal system, So how can it actually lead to heart failure in children? All right, let's establish it. So these are non-cardiac causes of heart failure. All right, you have a heart failure, and the issue is not primarily from the heart. The issue is actually referring to the heart. Okay, so metabolic acidosis is just a condition where the body accumulates too much acid. Do you understand? It's either acid is accumulating too much, or base is becoming, you are losing base. Okay, so it's actually a serious contributor to heart failure in children, especially in critical illness and underlying metabolic disorders. Do you understand? Like, single-handedly, it can't really cause heart failure ASAP like that, but if it's now combines with other complications that the child has, it makes it faster for the child to actually develop, heart failure. So what is metabolic acidosis? The pH is low. It's going towards the acidic side, so it's below 7.35. Do you understand? Or the base that is supposed to be there to dilute the acid, you are losing it too much. That's bicarbonate. Okay, so increased acid production, decreased acid excretion. It could be that acid is still being produced normally, but kidney is not putting it out more. Do you understand? The loss of bicarbonate. If you have diarrhea, you are passing out watery stool too much. This could actually result into you losing all those acidic electrolytes, basic electrolytes. Okay, so how does it lead to heart failure? Myocardial depression. So acidosis indirectly impairs how the muscles are contracting. So hydrogen ions interfere with calcium handling in cardiac cells. This reduces the strength of each heartbeat. It can lead to low cardiac output and ventricular dysfunction. Arrhythmias. Acid-base imbalance is what disrupts electrolyte level. That's the heart is not beating normally again. Okay, so vasodilation and hypotension. So acidosis causes systemic vasodilation. So the blood vessels are becoming big. Do you understand? So the blood is having a much more bigger, pathway to flow. So it reduces blood pressure. So heart compensates by increasing the rate and force. So this can actually strain the heart muscles. Then respiratory compensation fatigue. So children compensate for acidosis by breathing rapidly. You understand? So it could lead to what? CO2 building up, worsens acidosis, leading to respiratory failure. Now respiratory failure, this respiratory failure also leads to affecting the heart. Multi-organ dysfunction. So severe acidosis affects kidneys, the liver, and the brain function. So this systemic collapse can overwhelm the heart. All right, especially in children that are still just coming up. All right, and if the children also have some other underlying heart issues, okay, makes everything worse. Okay, so that's it for the link between metabolic acidosis and heart failure in children.